Hi, I'm Dr. Dean Peppard, and I'd like to thank you for taking a moment to watch this brief video. In this video, we're going to discuss a little bit about injuries and chiropractic. Oftentimes, we have patients come to our office who have recently been involved in an injury, whether it was a car accident, a motorcycle accident, or they were a pedestrian hit by a car, or they were on a train and they sustained an injury on the train, or they were on a plane and the plane made them sustain an injury. So I want to address a little bit of patients who have had those injuries and a lot of the questions that they commonly have associated with those injuries. So the first question that's first and foremost on a lot of patients' mind is, are we able to help these patients? And I would like to say unequivocally, most of the time, yes, we're able to get very good results in helping patients who have had an automobile accident, for example. The next most common question I get is, will my insurance cover it? And to answer that question, it depends, unfortunately, is the correct answer. Sometimes patients will have insurance which will cover their injuries, and this would be different for each patient. Let's take, for example, patients who have been in an automobile accident. The first place to start would be to look for your declaration page. When you purchase insurance for your automobile, your insurance company will send you a declaration page. That declaration page will state all of the benefits that you bought and all the policy limits. And I'd like to just take a moment to review a little bit about that declaration page. A lot of people are not clear what all the benefits are. So you might notice that there's a place for bodily injury or uninsured motorist. This part of the insurance will cover people that you might have hurt if you were at fault. If you continue looking at your policy, you'll see a place where there's a section for medical payments. Medical payments is a benefit that is applicable to you. So if you are injured in the accident and you purchased medical payments as an additional benefit, you may be able to use this to come and have your care paid for in our office. Because there are so many different types of medical payments benefits, and there are ramifications of different types, and the billing is a little bit different for the different types, I'm going to provide a link to you to go ahead and visit the website of an attorney who's in the Los Angeles area, who gives a very good breakdown of the different types of Medpay and how they can benefit you. So I'd encourage you to please click on that link and to please watch this video after you're done completing this video, of course. The next question I get asked often is, the injury that I was involved in was not through my own fault. For example, a person might commonly tell me they were sitting at a stop sign and somebody rear-ended them. So through no fault of their own, the other party is the party at fault and not the person who actually comes in for care. In that situation, we do not have any direct relationship financially with the party that hit you. We only have a financial relationship with you. Therefore, we are unable to bill and get any reimbursement directly from the party that hit you's insurance. The arrangement that most insurance companies typically use to settle a case is they will negotiate with you, who are our patient, and by the time that you and the insurance company reach a settlement, then out of those funds we will get reimbursed in our office. And this kind of leads to the next question. Many times patients will come to our office following an injury and they want to know, do I need to have an attorney to manage my case? And the answer is, it depends. Some cases are simple and they can be easily resolved without retaining an attorney. Other cases, sometimes it's best to consult with an attorney and find out exactly what the value of your case is. Other times, if you're unsure, it might be best to talk with an attorney and see which is the best route for you, to either retain an attorney or to just go it on your own. So lastly, patients like to know, if they've decided that they would like to come to our office for care, how does the money issue work? Well, there's several options for you available. First, primarily, we do accept cash. If you would like to pay for your care as you go, you certainly are able to do that. We accept cash, credit cards, and checks, and you can get the bill at the end of the care, and you can negotiate with whoever the responsible party is on your own. Another option is, of course, is the medical payments benefit. In that situation, you would come to our office, we would provide the services for you to get the care that you need, and we would directly bill the insurance company's medical payment. That would be your insurance. I also would like to point out, in this scenario in which we bill medical payments, this would not cause your insurance rates to go up if you are not at fault. That's kind of a misconception a lot of people have, and it is not the case that if you are innocent in your injury that you would have to have your premiums go up. Lastly, you could retain an attorney. In the event that you sign an agreement with an attorney and you come to our office for care, we would accept your case on a lien basis, and that's provided, of course, the attorney signs our lien, and we would provide the care that you need, and at the end of the care, we would let the attorney know that you're discharged, and at that point, your attorney could negotiate with the insurance company on your behalf to get you an appropriate settlement. Well, I hope this answers a lot of the questions that a lot of patients have regarding injuries and accidents and chiropractic in our office and how that all works. And I would like to encourage you, if you do have any further questions, please feel free to call our office and speak with any of our staff members, and they can give you more details on your case in particular. Our phone number is 714-821-4265. Thank you, and we look forward to being of service to you soon, and we appreciate you watching this video.